So you're gearing up for a medical procedure, and you totally know the drill. You've had the endless consults, you've got the calendar marked, and you're finally mentally prepped to just get it done. But then, bam, they hit you with it. You need to squeeze in yet another medical appointment right before your surgery. I know, it really feels like just another frustrating hoop to jump through, right? Well, today in this explainer, we're going to break down exactly what this visit actually is, why it is absolutely critical for your safety, and how to seamlessly navigate all the logistics if you happen to be in the LA area. Let's dive in.
Now, you might be wondering, and let's just address the elephant in the room here, why can't we just get straight to the surgery? Honestly, the short answer is no. Your surgeons simply won't touch a scalpel without this step. They absolutely need medical clearance to confirm that your body can handle the immense physical stress of both the surgery itself and the anesthesia. And trust me, once you understand the real why behind this, it kind of changes the whole game.
So here is our game plan for today. 1. Beyond a formality. 2. The pre-op timeline. 3. Tests you might need. 4. Your appointment checklist. And 5. Logistics in Los Angeles.
Section 1. Beyond a formality. A crucial checkpoint for your surgical safety.
Okay, we really need to completely shift how we think about this visit. It is time to stop viewing this as just a pile of annoying paperwork. Instead, think of it as a mandatory pre-flight safety check for your body. The goal here isn't to waste your time. It's to catch hidden, potentially serious risks, like an irregular heartbeat or maybe an undiagnosed blood condition, well before you're ever on the operating table. Because finding those things out while you're deep under anesthesia, that is incredibly dangerous. Finding them out in a primary care office days beforehand, well, that's just smart medicine. It's the ultimate way to ensure that when you go under, your body is 100% prepared to handle it.
Section 2. The pre-op timeline. When to schedule your checkup. You know, timing this appointment is actually a bit of a delicate balance. The absolute sweet spot is usually right around 1 to 2 weeks before your actual surgery date. Why? Well, this ensures your test results accurately reflect your current state of health while still leaving us enough runway to safely fix any concerns that might pop up. But there is an exception. If you have some complex medical conditions or you're going in for a particularly intensive surgery, your provider might actually want to see you even earlier just to give your care team plenty of time to prepare.
Section 3. Tests you might need. Customizing your safety check.
So what exactly happens during this visit? Well, your provider is going to customize the tests based on your age and your specific health history, so you definitely might not need all of these. But standard tests usually include things like a complete blood count and a comprehensive metabolic panel. We need these because anesthesia is heavily processed by your liver and your kidneys, and we have to know they are firing on all cylinders. They might also run coagulation studies to ensure your blood will clot properly. An EKG checks your heart's electrical wiring, a chest X-ray takes a good look at your lungs, and a urinalysis checks for any underlying silent infections. Basically, it's a complete, top-to-bottom snapshot of your internal engine.
But wait, what happens if they actually do find a red flag during these tests? Far from being a roadblock, you guys, this is actually a massive win. If a concern is identified, your provider immediately alerts your surgeon and you enter what we call the optimization phase. They might just tweak your current medications a bit or treat the underlying issue right then and there. Catching it now means fixing it before you ever set foot in the operating room, ensuring you can proceed safely. That's exactly why we do this.
Section 4. Your appointment checklist. What to bring with you.
Let's get really practical for a second. Bringing the right stuff makes this appointment seamless. First, you need a complete, updated list of your current medications. And yes, that includes the exact dosages and how often you take them. Bring your insurance card, your photo ID, and any relevant past medical records, recent tests, or imaging you might have. But here is the most absolutely crucial part. Bring a detailed list of any known allergies or previous adverse reactions you've had. This is literally mandatory for life-saving anesthesia safety. And finally, don't forget your surgeon's info and the exact planned procedure details, just so the clearance team knows exactly what they are clearing you for.
Section 5. Logistics in Los Angeles. Where to go and how it works. All right, if you live in the greater LA area, getting this checkup scheduled shouldn't be a geographic nightmare. Elevate Health Group runs these specialized checkups across their offices in Glendale, Burbank, and La Cañada. They really crack the timeline problem for you by offering same-week appointments so you can easily hit that crucial 1 to 2 week window. Need chest imaging? The Burbank location actually has on-site X-rays, which means you get same-day results and completely skip the hassle of having to get an outside referral. Plus, they handle all the heavy lifting of coordinating directly with your surgical team for you.
Now, a very common question we get, what is the financial damage going to be? Well, because this is a strictly required medical safety check, it's generally billed just like any standard office visit. That means it's typically going to be covered right under most major insurance plans, subject to your standard everyday copay, so no big surprises there.
When it comes to your peace of mind right before surgery, experience really matters. Elevate Health Group's board-certified physicians have successfully navigated this exact clearance process for over 10,000 satisfied patients. Think about that number. You definitely want an experienced, well-oiled crew running your pre-flight safety check, and a track record of over 10,000 patients pretty much proves they deliver true reliability and top-tier care. So, if you are located in LA and you need to secure your surgical clearance, you can easily reach out to Elevate Health Group at 818-246-8000 or just visit them online at elevatehealthgroup.com. But as we wrap up this explainer today, I really want to leave you with a quick thought. We wouldn't dare board a commercial airplane if we knew the pilot just totally skipped the pre-flight safety checks, right? So why on earth would we treat our own bodies with any less care before going under the knife? Don't view this appointment as a hassle. View it as the ultimate necessary insurance policy for your health. Stay focused, stay incredibly safe out there, and we will catch you in the next explainer.